Welcome to this explainer for the MSL Insights educational series. Today, we're demystifying the day-to-day reality of medical science liaisons. Look, if you're pursuing an MSL role or maybe you're already in one, understanding exactly how you're measured is absolutely crucial because at the end of the day, those metrics, they dictate your schedule, your travel, and ultimately your success. So let's break it all down. Before we really get into the weeds here, I want to clarify something up front. This entire educational explainer is grounded completely in the personal, professional opinions and experiences of Savannah Parker. She's a practicing MSL with her PharmD, MBA, and BCPS. So the framework we're walking through today comes straight from her direct, real-world insights working in the pharma industry. Okay, here's our roadmap for today. We'll be looking at 1. The role of metrics. 2. Interactions and face-to-face time. 3. Field insights. 4. Conference coverage. 5. The qualitative impact. And 6. Essential questions. Starting off with Section 1. The role of MSL metrics. To kick things off, you've really got to know who you're actually tracking. Engaging providers in neurology is going to look incredibly different than, say, cardiology. Your metrics revolve almost entirely around key opinion leaders, your KOLs, and healthcare providers. And if you're inheriting a brand new territory without a nice, warm handoff, well, you've got to identify these KOLs yourself. A great place to start is with academic medical centers, authors of major clinical guidelines, and conference speaker lists. Searching those 3 specific areas will reliably surface the most influential scientific voices in your therapeutic area. Moving right along to Section 2, HCP interactions and face-to-face meetings. So if you want to stay sane in this role, mastering what we call the quarter-ahead habit is essential. Timeframes for measuring your interactions can honestly range anywhere from daily to yearly, depending on the company. But scheduling a full quarter in advance, that allows you to actually secure time with top-tier KOLs. Remember, these folks are incredibly busy running clinical trials and seeing patients all day. You might have a community provider who's totally fine with a week's notice, right? But a busy resident group? You're booking them out months in advance. Managing this timeline proactively makes your present-day life significantly easier. And this basic equation right here is pretty much your daily reality. Your interaction quota plus the physical size of your territory equals your windshield time. It's just math. If you've got a massive multi-state region and a really high interaction target, you're going to be spending countless hours behind the wheel or just hanging out at airport gates. On the flip side, a really dense city territory, like Manhattan, for example, means way less travel time, but a highly, highly competitive calendar. You absolutely must understand this dynamic before you accept a role. Closely tied to that overall interaction count is the specific percentage of those meetings that literally have to be face-to-face. Sure, virtual calls are super convenient, but most companies really want you in the room. Why? Because true relationship building and deep scientific exchange just happen better in person. The higher this percentage requirement is, the more time you'll spend on the road meeting KOLs. It's a vital factor to pin down so you can set realistic travel expectations for yourself. All right, let's jump to Section 3, gathering and submitting insights. Insights are arguably the most critical MSL metric out there. Because you're out in the field every day, you are literally the eyes and ears of the organization. And an insight isn't just something vague like, Dr. Smith liked the data. No, it's more like, Dr. Smith is hesitant to adopt this drug because of a very specific side effect he's seeing in his elderly patients. See the difference? Headquarters relies heavily on that exact boots-on-the-ground intelligence to shape massive strategic decisions, pivot their clinical trials, or even update their educational materials. Which leads us nicely into Section 4, navigating conference coverage. Now, the actual number of conferences you cover is going to depend heavily on your team's size and budget, but take a look at this breakdown. National conferences get all the hype. They're high stakes, they're stressful, and leadership is everywhere. But I want to make a really strong case for local conferences. Local conferences actually offer an exceptionally high return on investment. Why is that? Well, because almost everyone you meet there is a potential long-term relationship within your own specific territory. They might not be the flashiest events, but they're absolutely invaluable for building a network right in your own backyard. On the other end of the spectrum, for those of you aiming for international conferences, keep in mind these are usually reserved for tenured MSLs who are supporting very high-ranking KOLs. You're not just dealing with long flights and terrible jet lag here, you're navigating entirely different global pharma regulations, super strict compliance rules, and potential language barriers. It's a massive logistical undertaking, for sure. That brings us to Section 5, the unmeasured qualitative impact. We really need to talk about the elephant in the room. While things like interaction counts and face-to-face percentages are super easy to track on a neat little scorecard, those numbers really only matter for your formal HR evaluation. True success in this role is highly qualitative. I mean, a spreadsheet can't capture that amazing moment when a KO actually texts you out of the blue to ask for your perspective on a newly published paper. That kind of ongoing scientific dialogue, built on deep trust and credibility, that's what makes you an invaluable MSL. That's the real reason an expert picks up the phone when you call.
And finally, Section 6, Essential Questions for Managers.
If you're heading into an interview tomorrow, or maybe you just have a one-on-one with your manager coming up, you really should be asking these specific questions. Are interactions measured daily or quarterly? What exactly is the face-to-face requirement? How are insight submissions tracked? What's the expectation for conference travel? And are there geographic restrictions? Asking these things upfront ensures you're aligning with a company philosophy that actually matches the lifestyle and the career you want to build. It saves everyone from nasty surprises down the line. Ultimately, Savannah Parker leaves us with a really powerful shift in mindset. She says, metrics become less of a source of anxiety and more of a useful tool for managing your time, your territory, and your career. So I want to leave you with this. Will you let metrics just be some intimidating scorecard hanging over your head, or will you use them as a strategic tool to completely master your territory? Because when you finally understand the framework, you take control of your career. How will you apply this to your territory starting today?